Rose George, The Big Necessity, The Unmentionable World of Human Waste and Why It Matters. Explore the unmentioned world of human waste and its global impact in The Big Necessity by Rose George. Delve into the shocking reality that 2.6 billion people around the world lack sanitation, living and struggling amidst human excrement. Discover the startling connection between the lack of sanitation and life-threatening diseases, as well as the importance of sanitation as a major medical advancement. This summary sheds light on the crucial role of sanitation in the economy, the prevention of diseases, and the enhancement of public health. By understanding the importance of sanitation, we hope to inspire action and discussions to help save lives.
Sanitation Crisis. Over 2.6 billion people globally live in environments without access to any form of sanitation. This results in a significant spread of diseases with poor hygiene and contaminated water causing 1 out of every 10 illnesses in the world. The situation leads to tragic child deaths from diarrhea every 15 seconds, with UNICEF citing it as a significant challenge to survival in developing countries. Lack of access to basic sanitation is a bigger threat to children than AIDS, tuberculosis, and malaria. The severity of the issue is compounded by the staggering amounts of fecal matter that sanitation-deprived individuals consume or come into contact with every day. Sanitation, the greatest medical breakthrough. The British Medical Journal surveyed its readers to determine the most significant medical innovation, and the winner was not penicillin or vaccines but sanitation. Sanitation is responsible for the most substantial reduction in child mortality rate in British history. Diarrhea claims approximately 2.2 million lives every year, yet safe disposal of human waste could reduce it by nearly 40% in developing countries. Sanitation also has significant economic benefits, with the potential to save billions of dollars in hospital visits and medical bills. Peru's 1991 cholera outbreak cost them $1 billion to contain, but a $100 million investment in sanitation could have prevented it. If we invested $95 billion in worldwide sanitation, we could save $660 billion. Despite these benefits, sanitation is not a top political priority. Investing in proper sanitation would not only make people healthier but also wealthier. The Sanitation Taboo. People don't talk about sanitation, and it may be due to the limitations of the English language. Our coarser moments have us saying shit, medical terms use stool and bowel movement, and formal language has feces and excrement. There's no neutral term to use in civilized conversation, as language reflects our attitudes towards defecation. This trend can also be seen in the language of international policy. Despite using creative lingo to sanitize the dirty implications of the toilet, human waste remains a low priority in government budgets. Pakistan spends 47 times more on its military than on clean water and sanitation, resulting in 120,000 deaths per year due to diarrhea. Additionally, foreign aid agencies focus 90% of their sanitation-related budget on supplying water, which reduces diarrhea by only 16 to 20%, instead of investing in sanitation, which could reduce it by 40%. The community-led solution. In India, open defecation is a major problem that affects the health and daily lives of many people. Despite the implementation of millions of latrines by the India Central Rural Sanitation Program, many of these latrines remain unused. Activists have taken a different approach, using community outreach and creative psychology to convince people of the health hazards of open defecation and the advantages of using toilets. Kamal Kaur, an Indian consultant for the non-profit organization WaterAid, inspired a village-wide initiative in Bangladesh by getting the villagers to realistically calculate the amount of fecal matter in the area. This initiative sparked the adoption of the community-led total sanitation (CLTS) method. CLTS has been a successful approach towards tackling the issue of open defecation, and it has been adopted in India and elsewhere. The dark side of sanitation. Sanitation issues exist not only in underdeveloped countries but also in wealthy nations like the United States. Even though the country is the most powerful in the world, over 1.7 million Americans still lack access to proper sanitation. The wastewater system in the U.S. received a grade D in 2000 and a D- in 2005 by the American Society of Civil Engineers. The U.S. Environment Protection Agency estimates that by 2020, half of the country's sewage pipes will be in danger of collapse. Moreover, New York City's sewage system is vulnerable to rainwater, as shown by the flooding of the subway system in 2007 when the tracks were flooded with more water than the pumps could handle. This system discharges 500 million gallons of raw sewage every week into bodies of water, contributing to environmental pollution. The transformative power of human waste. Did you know that human waste can be transformed into energy and fertilizer? From bricks to biogas, feces can be put to good use. In China, millions of rural households have installed biogas digesters connected to their toilets to convert waste into energy and fertilizer. This innovative method not only saves natural resources and reduces conventional energy costs but also produces a byproduct that enhances vegetable yields by 50 to 60%. Moreover, fecal transplants have shown a 90% recovery rate for patients with bacterial infections. It's time to consider the potential of human waste and explore how it could benefit society. The complexities of human waste reuse. Reusing human waste seems like a promising solution to the global sanitation problem, but it comes with a host of issues. Rural farmers in China rejected biogas as a result of the new, high-maintenance toilets, opting for unsanitary latrines and contributing to deforestation. Furthermore, the leftover biogas slurry used for fertilizer caused controversy over whether or not it could still be harmful. While biogas has the potential to be a solution, it is far from perfect. However, discussing sanitation is necessary to make progress in finding feasible solutions. As everyone uses the toilet, we should approach the topic of sanitation with an open and positive attitude. Sanitary discussions are not just about hygiene but are also central to our humanness, including the national economy, politics, the role of media, and our cultural preferences. With this in mind, it's time to start the conversation and save lives.
In conclusion, The Big Necessity exposes the crucial problems that emerge due to the lack of sanitation around the world and its devastating consequences. Although investments in sanitation can bring about significant medical and economic benefits, the issue of human waste receives little attention on a political and global scale. While there are potential uses for human excrement, such as in the production of biogas, further development and research are required. However, to address these issues and explore viable solutions, our attitude towards the discussion of sanitation must change. Open and constructive dialogues can lead to new innovations and developments that could potentially save millions of lives.